Neurodevelopment outcomes in the early CPAP, that means continuous pressure airways pulsation. And the pulse oximetry trial. Previous results from our trial of the early treatment with continuous positive airway pressure versus early surfactant treatment in infants showed no significant difference in the outcome of death or bronchopulmonary dysplasia.
This is a video in clinical medicine from the New England Journal of Medicine.
Since pulse oximetry was introduced 3 decades ago as a monitoring tool, it has become ubiquitous in operating rooms, intensive care units, and hospital wards. Before pulse oximetry was available, physicians relied on invasive procedures, such as arterial blood gas analysis, to identify the presence of hypoxemia. Pulse oximetry has now become the standard of care in operating rooms and intensive care units in the United States and many other nations. Although the pulse oximeter is easy to use, the clinician must understand the principles of pulse oximetry and must know how the equipment works in order to interpret the information it provides. This video demonstrates the equipment needed and how to use it. It also addresses the common applications of pulse oximetry, explains how to interpret the data generated, and presents its limitations as well as common problems encountered with its use. Oxygen is present in 2 forms in the blood, dissolved and bound to hemoglobin.
A lower versus a higher target range of oxygen saturation was associated with a lower rate of severe rhinopathy but the higher mortality. We now report longer-term results from our prospective hypothesis.
Sleep apnea is a common disorder in which there are one or more breathing or shallow breaths during sleep. Normally, without sleep apnea, your airway remains open. Your airway consists of your nose, mouth, throat, and windpipe.
No sé qué hice, este video me salió la patada, este sí que no le voy a pasar el play ni mierda. Una, hablaste, 2, yo hice mierdas aquí, retrocedí.